Hi friends, I am Dr. Ranganath and welcome to my YouTube channel. I'll be posting a series of videos pertaining to a single topic. So in this series I'll be speaking on the topic of obesity. So in this video we'll try to find out what is obesity, how do we define obesity, what are the various measurements used to measure the severity of obesity, and what are the advantages and disadvantages of each one of them. So what is obesity? Obesity is nothing but accumulation of extra fat in the body. We all have a certain amount of fat which is very essential for the functioning of the body. If it exceeds the normal amount, then it is called obesity. This abnormal accumulation of fat puts that particular person at risk of certain diseases. So how do we define obesity? Obesity is defined based on a parameter called the body mass index. If the body mass index of a particular person is more than 30, then he or she is said to be obese. So what are the various measurements used to measure the severity of obesity? One is the body mass index. So body mass index is calculated using a formula where you require two values. One is the weight of the person and the other is the height of the person. So the formula is weight in kilograms by height in meters square. For example, if you take my example, my weight is about 63 kgs and my height is about 1.72 meters. So by using this formula, 63 divided by 1.72 into 1.72, the calculation would be 21.5. So my body mass index is 21.5. So based on the body mass index, a particular person is classified as being either normal, underweight, overweight or obese. If a BMI of a particular person is between 18.5 and 24.9, then he is classified as being normal. If the BMI is less than 18.5, then he is said to be underweight. If his BMI is between 25 to 30, he is said to be overweight. And if his BMI is more than 30, he is said to be obese. And if his BMI is more than 40, he is said to be severely or morbidly obese. So what are the advantages and disadvantages of taking this measurement? One is fairly simple and inexpensive. You don't require any fancy gadgets or tools to make this calculation. All you need to have is the weight and height of a person. So everybody knows what is his height and weight, and you can use this formula to make a measurement. You can just type a BMI calculator on Google and put in your values and it will give you a measurement. The other advantages is very fairly commonly used both in clinical studies as well as in clinical practice, and most clinical records have a documentation of height and weight of a person, and as BMI can easily be calculated based on that. So what are the disadvantages of using BMI? One is it is not very reliable in elderly, because elderly tend to lose muscle mass and put on body fat. So for the same BMI, they tend to have more body fat as compared to a younger individual. And even though their BMI is normal, they might not be classified as being overweight or obese when actually they have more amount of fat in their body. For the same reason, women and Asians tend to have more body fat for the same BMI. And the other disadvantage is it doesn't differentiate between the body fat and the muscle mass. If a particular person's weight is more because of muscle mass, say for example, we take a example of a bodybuilder who has a lot of muscle mass, his weight might be more, but that weight is mostly because of the increased muscle mass and not fat. So he might be classified as being overweight even though his fat content is low. And the other disadvantage is it doesn't specify where exactly this fat is located, because the location of the fat in the body is also very important, particularly the location or the accumulation of fat around the belly and the stomach is which is also called as central obesity, is very dangerous, because this is associated with most of the obesity related diseases. So this is all about body mass index. So what are the other measurements? The other measurements that are used are the waist circumference and the waist hip ratio. So what is waist circumference? Waist circumference is not actually the measurement of your trouser of the pant size. It is the circumference of your waist, which is taken at or 1 inch below the umbilicus. The ideal measurement is done by locating the upper part of the pelvic bone and the lower part of the rib cage and the measurement is done actually midway between these 2 points. And there are various limits that are being given. In the Westerners, if the waist circumference is more than 1 or 2 centimeters in males and more than 90 centimeters in females, this is said to be abnormal. But this has been modified based on the ethnicity. For Indians, if the waist circumference is more than 90 centimeters in males and more than 80 centimeters in females, this is said to be abnormal. See, the advantage of waist circumference is it is actually trying to measure the body fat where it actually matters the most. So the accumulation of the body fat in the around the belly is most important, and this is what it is trying to measure. So what is the other parameter? The other measurement is the waist hip ratio. You take the waist measurement, you take the hip measurement and divide it to get a ratio. Normally in males the ratio should be less than 1, and in females the ratio should be less than 0.9, and anything more than this is said to be abnormal. See, what are the advantages of waist hip ratio? The advantage is it is very useful for people who are on the extreme physiques. Say for example somebody is very short and his waist circumference might be still normal. For example, if a particular short stature man has a waist circumference of say about 88 centimeters, so he is said to be normal because it is less than 90 centimeters. But for his weight, for his height, there could be a lot of fat that is accumulated in the body. Similarly, if a person who is about 6.5 or 7 feet tall and his waist circumference can be more than 90, but he might not be having that much of fat because his build is more, the waist circumference will also be more. So this is particularly useful for people who are at their extreme physics, like people who are very tall and people who are very short. The disadvantage is if somebody is on a weight loss program, they are losing their weight, the waist hip ratio will not change very drastically because they will be losing weight both around the waist and as well as the hip. So the ratio will take a lot of time to change. So this is not a very good measurement if you have to serially calculate or try to see how much weight you are losing. Now let's see what are the direct measurements of the body fat content in the body. So the body composition is actually simplified into a two-model concept. It is actually divided into fat mass and lean body mass. So fat mass is the accumulation of fat, and lean body mass comprises of bone, the muscle tissue, the vital organs like the brain, heart, liver, kidney, and so on, and also blood and water content of the body. So there are some measurements which will directly tell you what is the fat content, and one of them is the skin fold thickness. Skin fold thickness is you try to measure the thickness of the skin fold. So this is actually done measured by using a instrument called a skin caliper, and there are 4 sites that are commonly used. One is the front of the arm or over the biceps muscle, the second over the triceps or the back of the arm, third is just above the level of the pelvic bone, and fourth is in the back below the level of the scapular bone or the shoulder blade bone. And out of all these 4 measurements, the measurement over the triceps or the back of the arm is said to be most accurate. You add all these values and use a table, conversion table, and put that value in the table, and that will give you what is the fat content of that particular person. So the advantage of this measurement of skin fold thicknesses is one of the easiest way to know what is your fat content in the body. But you actually require an instrument called the caliper, which you can always buy it online. And there are some disadvantages of this measurement. One is it is not a very accurate kind of a measurement, and it is not reliable in elderly because elderly the skin will be friable and the muscle will also be friable, and if you are trying to measure the skin fold, the muscle actually can come inside the skin fold and it can give rise to a wrong measurement. Similarly, it cannot be used in a person who has swelling of a limb because of any particular reason. And the other disadvantages, it has a lot of inter and intra observable variability, where that is, if a particular person's measurement is done by 4 different examiners, there is a chance that they can come, each one of them can come up with a different result. And if a person's measurement is done by the same examiners at different time, then also there is a chance that different measures can be recorded. So it is very important that the person who is taking this measurement is trained to take the measurement. Only then the values can be accurate. So the second method that is used is called a bioelectrical impedance method. Although the name might sound very scientific, it is generally employed in the modern digital weighing scales that are usually present in fitness centers and in the gyms. So this is just like a normal weighing scale. You stand on the weighing scale, it will take your measurement, and that is connected to an app which you can download on your mobile by Bluetooth, and this will show what is your body fat content. The advantages are it is fairly easily available. You can, it is available in all the fitness centers and gyms, and you can also buy it online, and it's not very expensive. And the disadvantage is not very accurate kind of measurement. So if you want to accurately measure what is the fat content of your body, then there are 2 tests that are done. One is the MRI scan, and the other is a DEXA scan, which is similar to a CT scan. It's called the dual energy X-ray absorptiometry, and these 2 tests will give you accurately what is the fat content in your body. So you can just go through this table, which will tell you what is the normal fat content based on age and sex of a person. So in this video, we have learnt about what is obesity, how do we define obesity, what are the various measurements that are used, and what are the advantages and disadvantages of each one of them. So to summarize, body mass index and the waist circumference can be used together to accurately know what is the degree of obesity and the fat content in a particular person. If somebody is at the extremes of age, then you can use the waist hip ratio also. And one of the tips that I would give to measure the degree of obesity is to measure the waist circumference in relation to the height of the person. So the waist circumference should be less than half of the weight of a person. For example, take my example, my height is about 5 feet 8 inches, which is about 68 inches. So my waist circumference has to be less than 34 inches. So based on your height, if your waist circumference is less than half of your height, then you are said to be normal. And this is the most practical and easiest way to know the degree of obesity. So in the next video, we'll try to learn what are the diseases associated with obesity and what is the magnitude of obesity that we are dealing with. So thank you.